Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Okay. So I welcome one and all again in today's session. Now we've started the case discussion, and today is a very, very important case. I think every next person gets it in their final exams. So you have this hypertensive disorders in pregnancy, and when I say hypertensive disorders in pregnancy, it's a complete total class. I'll try to touch upon all the important aspects of hypertensive disorders in pregnancy. It's a huge case discussion. I'm very, very grateful to my student who has been kind enough to take this case discussion. We usually nurture an environment of helping each other through this class. We are in the process of learning. It's not a class to burden one person up for the case presentation. So I make sure that she's taken the case much early in advance, and then I get time to coach and I get time to mentor the person how to speak, what not to speak, and what kind of questions are expected from this. Okay, so the questions list usually I give them before. Maximum the kind of questions that can come, they prepare, and then they finally presented on the final day, that is today, in front of all these audience. And when I say audience, all my audience right now are also exam going. So my request to everybody is to be alert, attentive, and as you've done it in so many other previous classes in which you've been active participants, keep writing down the answers as I ask the questions in the chat box. My eyes are mostly there. There are so many comments that sometimes crowd the chat box. Maybe your comment might just miss in one or twice, but otherwise usually my eyes are there to explain you, to answer your queries, and at the same time to see whether you're answering right or not. So in this way, you'll be able to kind of prepare yourself for one topic in this stipulated time that we get with each other. So your at least hypertensive disorders is sorted. All right, again, I welcome one and all in today's class. And before I begin this class, let me just give you very important information. As you know, we have also started a small, beginning of helping you out in your thesis preparation. My advertisement has been going out from quite some time. So we have been started working on so many people's thesis at the same time, the protocols and manuscripts and the earlier, abstract topics. We've helped so many students, and again, now your thesis, as you know, I think had put one notice also, a floater as well, in which this information will come from the DNB office, that it will be now from a soft copy rather than a hard copy. So again, this is going to be it's a good news for all of us. I think the entire cost cutting is there, plus so much time gets wasted in printing, reprinting and stuff, and that all these things will come down. So we are there to help you out for your thesis as well. So this is one information I wanted to give you at the very onset of the class, that you, your friends, your seniors, juniors, whosoever needs help in making thesis. Okay, when it comes to making thesis, I'm talking about typing and sorting it out, making this thing, your tables and charts and pie charts and all these different computations that we're going to help you with. Okay, the topics will be yours, the data will be yours, the rest typing and everything will be ours. Correct? So we begin today's class with a very, very important topic. Like I said, the introduction which I gave you, it's a very oft repeated favorite of almost all examiners, very, very highly, a common scenario in our OPDs, in our wards. So please be attentive right from the very beginning. Please be alert and please participate. She's not the only one who's presenting. All of you are presenting. And in between, you should also speak. Like in previous class, I'm very happy that she was the one who took lead and she kept volunteering to answer, and now she's so confident that she's presenting an entire case. So again, a lot of strength to you, a lot of power to all my students. Let's begin tonight the case presentation. Over to you, Beta. Start.
Good evening to all of you. I'm presenting the case of Mrs. Radha, wife of Gopal, 30, female, resident of Lakshminagar, Delhi, Hindu by allegiance, housewife, educated 10th standard, graduate to Palliative 1 Life 1. Her LMP is of 27th July 2023, making EDT of 28th April 2024. She presented at our hospital with an amenorrhea of 7.5 months and for the routine antenatal checkup where her BP record was found to be high. She came to the antenatal OPD for routine checkup at 7.5 month period of gestation. Her BP was taken, which came to be high, and according to patient has told that her doctor also told that to admission for further monitoring because her BP was taken at the dispensary which was high. She has presented the
Can I just interrupt here? So she was a booked patient with you, right? Is it?
Ma'am, yes, ma'am. It's her fourth visit at our hospital, ma'am, which is at the
Okay.
third trimester.
So, okay, she's third trimester. This is the fourth visit at her the hospital. Okay, there's people who are listening. Can you quickly tell me what is meant by booking of a patient? This I think this is the second or third case. I don't know. I've not asked this question to my students. What is called as booking? Booking of any patient. How many visits are they supposed to be to call it a booking that the patient has got booked?
Booked patient.
Yeah, you can also answer.
Ma'am, booked patient has a minimum 4 antenatal visits, and she took the hyaluronic acid tablets for 100 days. She received
your voice is, I don't know, it was very fine up till now, Neelam. Your voice has suddenly started breaking. Okay. So if you do not have a good network, can you please just shift maybe to a better network or something? Yes. So everybody says it's minimum 4 visits that you need. Okay. Do you also need a tetanus toxoid to be given in those 4 visits? That will being called as a booking of the patient. Is it?
Yes, ma'am. Yeah.
Okay. You need 2 roses of tetanus toxoid at least. Is it?
Yes.
Or just the 4 visits will suffice. Okay, and what about this antenatal iron tablets that I don't think that is a mandatory for the booking of the patient, correct?
Okay, ma'am.
All right. So she's a book visit. How come she went to some dispensary in which the doctor told her that her BP was high, and then they asked her for a further monitoring?
Because for iron and for acid tablet, she went to the nearby dispensary, and where her BP then we claims to high, then she will referred to our hospital, ma'am.
Okay, so her blood pressure came out high in some other institute. Guys, please tell me if my voice is also breaking. I would want to check and correct this. Usually in the recording, you would not get any of this problem, at least not from my side. But just in case the voice is breaking, you can tell me in the chat box. Everybody who's there in the class, also please be there in the chat room so that it's a good communication between all of us. Since your voice is breaking, Neelam, that's why I wanted to be very sure. Right now, so she went into some dispensary. Her blood pressure was told that she has got a high BP, and she was asked to follow up here. All right, then what did you do? What history did you?
Ma'am, I would like to repeat the BP after the 4 hours of first BP reading taken, because her first BP reading 140 by 92. So I would like to repeat her second BP after 4 hours. So I asked the patient to just in the casualty for 4 hours so that we take the second reading to make the diagnosis whether it's a gestational hypertension and whether it's a preeclampsia.
Okay, just a minute, beta. Just a minute. Yeah, from my side, there's no breaking, but Neelam's voice is breaking. Is everybody feeling that? You can just quit the meeting and come back again, Neelam, because I am presenting the slides. Okay, can you just do that?
Yes, ma'am.
Yeah, just log off and log in. In the meanwhile, I'll just brief my students regarding this blood pressure thing. Okay, but when you join in, I'll have to again put your voice back. Huh? Yeah, just log off. I'll do it in the meanwhile. Okay, so the problem with this blood pressure thing is that what she's trying to say is that she had one BP recording high, which came out to be in some a clinic away and apart from the hospital that she's booked with. They asked her to go through, and she's come back here, and now her BP recording 140/90. Now tell me that, guys, 140/90, is that a blood pressure recording in which you will admit the patient, or what will you do with this patient?
Ma'am, at this BP record, generally we don't admit this patient, because if it comes to be the we can also do the outpatient OPD basis pay. We can also do the follow-up, yes, ma'am.
Correct. So suppose her BP recording was 160/110. Okay, the first reading was 160/110. Would you admit this patient?
Yes, ma'am. I surely admit this patient, because the blood pressure record, it's on the basis of because her blood pressure is very high, 160/110. So I will admit this patient and and further investigate this patient, ma'am.
Okay, and would you not repeat the blood pressure after 4 hours? Suppose the next BP comes out to be 140/90, you never know. Suppose it's 160/110 at one reading, right? So would you straight away, in our setting, I'm not talking about European countries which make the guidelines, in our setting, one patient comes in the OPD, your ward is already full with 100 patients. She came, and every next patient, nowadays hypertensive disorders are there, which are very, very common. Okay, around 20%, right? 11 to 20%. So one reading came out to be 160, 110. Would you admit this patient with one reading?
Yes, ma'am. I surely admit, because I have to take the second BP reading at very short period of time, that is 10 to 15 minutes, ma'am.
So you will still admit, huh? What about the others? What do you say?
And other BP recording, if it comes to be 140, 94, I will just I can also do the follow up on the OPD basis also.
Okay, my answer in this case will be that if suppose one reading has come out to be 160, 110, this is a severe enough reading to warrant further investigation, or at least a further blood pressure check, even otherwise also. So we'll just ask her to wait for maybe 3 to 4 hours, ask her to rest for a while, maybe ask her to have food or something and come back, and then we'll recheck her blood pressure. If that also comes out to be high, we'll have to admit this patient for further investigations and management. Okay, if 160, 110, you can say straight away admission, that will still be justified. Don't worry, it's too high a blood pressure to just let the patient go. What if she doesn't come back? Specifically in our kind of government setups, some patient might not come back also. So leaving a patient of that level of blood pressure is not good. And plus, of course, then you go on in the history, then you'll automatically answer my questions. Yes, Neelam, go ahead.
Yes, ma'am. Patient had no history of headache, blurring of vision, chest pain, decreased urine output, swelling of feet, or the excessive weight gain. She had no history of pain, abdomen, leaking per vaginum, and the bleeding per vaginum.
Okay. And why did we ask these things to her?
To rule out the severe preeclampsia, ma'am.
Yes, absolutely. These are all signs and symptoms of severe preeclampsia, severe features of hypertensive disorders. They are associated with whichever hypertensive disorder. This is a severe category. All right. Okay. So I think we've answered most of my questions. Please go ahead with the history of presenting pregnancy. And why am I scrolling down is because I want to know just the positive points, if you found any in your history.
Ma'am, I have no positive points. Just only BP was only there, ma'am.
Was high, and that too at this visit. Yeah, you are safe to say that. No problem. Because then I will come to the next question. That in which trimester do you start looking for these changes in her blood pressure? Why is it so important?
Ma'am, we start looking the BP records from 16 weeks onwards, ma'am.
Yeah, basically 16th trimester, you can safely say, yeah. Yeah, go ahead.
Ma'am, because at this level, ma'am, normally generally the first wave of tropoblastic invasion will start in the first trimester, and it will get completed at the 16 to 20 weeks of onwards in a normal pregnancy.
Yeah, absolutely. And what does that do? That wave, what does it do?
Ma'am, it will make the normal pregnant patient to the refractoriness to the various vasopressor agents like angiotensin, endothelin, and
okay. What else?
Which will do the lowering of the blood pressure, ma'am. So that there's a transfer of fetus blood flow of the blood to the fetus.